All right, so good afternoon, everyone. Good afternoon, all. Welcome to our afternoon service.
Good afternoon, Uncle.
Today, we are continuing with God's wonderful creation, and we're talking about the human body. In science, they call it the human anatomy. We are talking about the human body. In science, they call it the human anatomy, right? So with Dr. Tinabo Ndebele, he's going to first introduce himself fully. What does he do? What does a doctor do? And all those kinds of things. And then he will take us through the lesson. If you have questions, note them down. And after 10 to 15 minutes of Dr. Ndebele's presentation, then we're going to ask our questions. Is that fine?
Yes.
Yeah. All right. So if you can type and you know how to write, then you can use the chat button and then just ask your questions there. And then if you cannot, then you can lift up your hand and then we'll ask you to speak. And you can easily unmute yourself and then you can speak. All right. So Dr. Ndebele, you can just take over.
Hello, everybody. Hello.
Hello.
Hi. How are you? How is everybody? Happy Sabbath.
Happy Sabbath. Happy Sabbath. Happy Sabbath. Happy Sabbath. Happy Sabbath. Happy Sabbath. Happy Sabbath.
Yes. Thank you. Thank you, everyone. My name is Dr. Ndebele. My first name is Tinabo Ndebele. I'm a doctor. I'm a doctor who's working in South Africa, Johannesburg and Pretoria. Hello.
Okay, let me mute them. Let me mute them and then you can unmute yourself.
Okay.
You can unmute yourself and then proceed. We are still muted. Okay.
Hello, everybody. Happy Sabbath. My name is Dr. Tinabo Ndebele. I'm a doctor practicing in Johannesburg and Pretoria. I'm a gynecologist in training. A few months to completion of my specialist training. I was asked specifically to talk to you as a doctor and to hopefully inspire you one day to be my students and my colleagues later in life. So generally we're talking about the anatomy of the human body and the journey to becoming a doctor. So we all know a doctor is a person who helps people in need. Everyone at one particular time needs to visit a doctor. Everyone at one particular time needs a doctor's services. Therefore, doctors are very, very important. They are very respectable. And doctors are in demand. There is never a time where there is an oversupply of doctors. So all the time, doctors are needed everywhere. Be it in our communities, in the country, or everywhere in the world, doctors are in demand. Hence this talk, so that I can inspire you from your age. You can start dreaming now and hopefully join this noble profession. My computer is very, very slow. So we all know the greatest physician himself is God. God is the one who heals. God is the one who ultimately says a person lives and a person dies. So we as doctors are there to help God. God helps us to help you. We are doctors' right-hand men. Being a doctor is a calling. The Bible says, go ye therefore. Those are verses in the Bible. And most importantly, anyone, anywhere, from any corner of the world can become a doctor. It does not matter where you start from. This is my personal experience. You start from right. Yes, I'm there.
I can't hear you.
You can't hear me. Can you hear me, Shepard?
Yes, I can hear you.
Can everybody hear me?
Yes.
Okay. So I'm saying you can. So encourage everyone, anyone who wants to be a doctor, to dream and to study and to work hard. Anything is possible. A picture of my background on the background there, with the verse saying, I can do all things through Christ who strengthens me. So as long as you have God by your side, you can be anything that you want. You can be a doctor, you can be a pilot, you can be an engineer, you can be anything that you want. You can be an inventor. So the journey to being a doctor, obviously you have to start from primary school, which is where most of us are. At primary school, we play with our kids, with our peers and friends. We respect our elders. We just do a bit of studying, but we are there to nurture, to be able to learn how to live with people who are not in our families, with people in the community. You have to start liking a bit of maths and science, know how to calculate, how to add, how to make decisions. Then we go to secondary school. Secondary school, we do more learning. We learn more things, to respect friends, to respect peers, siblings, and most importantly, and always, we should always remember to respect the elderly and your parents. You need to pray every day. I hope all of us pray every day before we sleep. And the first thing we do when we wake up is to pray as well. This is where we start learning how to work hard. You study hard, you focus on science subjects, specifically biology, which is life sciences in South Africa, chemistry and physics, and in other countries, Zimbabwe, in the United Kingdom, Australia, it may be called physical sciences. Then after hopefully we pass very well, we go into medical school, we enroll. Getting into medical school is very hard everywhere because there's competition. Everyone wants to be a doctor. Most people want to be a doctor. It's a good profession, it's a good job. You study very hard, the training is very challenging, but it pays off and it's fulfilling at the end of the day. You remember, prayer and respect is tantamount. If you want to be a doctor, you have to respect everyone because you treat everyone. So treat everyone with respect, pray for everyone, pray for your neighbors. Our verse, if we can open 1 Thessalonians 5, verse 6 in the Bible, I'll read for you. Do we all have our Bibles?
Yes.
Okay.
Yes.
1 Thessalonians 5, verse 6. And then after we have graduated in medical school, we become doctors. This is the first time we change our titles from Mr. or Miss to doctor. We congratulate you on passing the medical degree. The good thing about medicine is you never queue for a job. You have one already. Wherever you train, when you are told that you have passed, you are now a doctor, the following day or the following possible time, you can start a job. Now life starts to be more interesting. There's no stress, no studying, just a bit of work. you are learning as an intern. This usually in South Africa is 2 years of internship. This is where you learn at big hospitals. You work at the big hospitals in the ropes of qualified doctors and mostly specialists before you are ready to stand on your own to make the decision of what you want to be. And then from there, this is where you make your career path in medicine. The career path is guided by the human body. The human body is a intriguing and interesting function. It has all major organs, the brain, the neck. In the neck, you have the throat, you have the lungs, you have the heart, the stomach, come to the liver. We'll pass through most of them as we go through. So God created us in a wonderful way. We were created in a fearful and wonderful way, says the Bible. So we'll start with the head. The head has the brain. So in the head, you have the brain. The brain, this is where we make all the decisions. This is where you decide, let me stand up, it comes from the brain. Let me go to sleep, it comes from the brain. Let me call my mother, I'm now hungry, everything comes through the brain. So you have doctors who work with the brain. So the doctors who operate on the brain are called neurosurgeons. We have a very good neurosurgeon that is known in our church, Ben Carson, as one of the brilliant neurosurgeons. He separated Siamese twins, the babies were born joined by the head. We also have important doctors called psychiatrists. These are doctors who treat people with a sort of a brain disease, but it's not really a brain disease. It's when you have depression or things are not working well, you're not making good decisions, and you have what is called a psychiatric illness. So those are the doctors. So you can choose to be either of those. You can be a surgeon who operates, or you can be a psychiatrist who works with depressed or people who are not feeling so well up there. Then we have brain and nerves. Our brain and nerves, the nerves start from the brain, they branch up, even up to the toes. Then the impulse starts from the periphery, come to the brain, and then you make the decisions. Then sometimes there's a disease in those nerves. There's a disease in the impulses passing from the brain going outside. So you have doctors who help fix those things. They're called neurologists. Then the next in the head, you have the eyes. The eye is the organ that sees. So this organ sees, as you can see at the base, where the blue starts there, at the black part is where you see, and then when you see something, it goes to the back of the eye through those blue nerves. It gets into the yellow thing that goes down. Then the impulses comes to our head to make a decision to say, oh, this is my mother, this is my father. So the doctors who help fix the eye are called ophthalmologists. They operate on the eye, they fix your eye. They work with other medical workers called opticians who are going to calculate if you need spectacles or if you need to be operated by the ophthalmologist. Then we have doctors who work with the ears, with the nose, and with the throat. They are called ENT surgeons, or medically we call them otorhinolaryngologists. So if you can't hear very well, or if your nose can't smell very well, or if there's something in your throat that is not okay, the tonsils, some of us have been operated for tonsils. These are the doctors who operate for tonsils. If you put something in your ears and the doctor needs to take it out, it's this doctor called an ENT surgeon. Then we have the dentist. That's the structure of the tooth. We all have teeth. Some of us don't have all of them, but they are coming. That's the teeth. We use it to chew. When we chew food, we put food in our mouth, we chew, and then it goes down the esophagus or the throat to the stomach, and then it gets into the body in the intestines. or the big tubes of the body, and then it comes out as waste products. From the throat, we go to the lungs and the chest. So the chest is made up of lungs. So the lungs are the organs. When air comes in through the nose, goes down through the windpipe, it goes into the lungs. In the lungs, that's where the oxygen gets into the body, into the heart, and then in the blood vessels, and then it goes to every organ in the body. We also have the heart. This is the pump of the body. This is the most important organ in the human body. This is the one that drives us. If it stops, we are dead. So it beats every time, every moment. It's beating as we speak, giving us energy and blood supply to every organ. So the doctor who treats diseases in the lung, the people who cough, who have pneumonia, who have TB, the doctor who treats that is called a pulmonologist. Pulmonary system means the chest and the lungs and these associated organs. Then the heart is treated by a doctor called a cardiologist. These are the doctors who are going to treat our parents, our grandparents, if they have heart attacks, if they have organs that affect the body. Then sometimes the heart needs to be operated, or those lungs need to be operated. So there's a cardiothoracic surgeon, or what we call the heart surgeon. They help in treating, in operating on the heart and the blood supply to the heart. Then we come down to the abdomen. The abdomen, the food gets in the mouth. We spoke about the teeth. We chew the food, then the food goes down through that pipe called the esophagus. It gets into the stomach, then it's distributed, some to the liver, some to the intestines, and then it comes out through the rectum there. So there are doctors who treat diseases that are there, called general physicians or internists. They will treat you when you have diarrhea, when your tummy is, when you have ulcers. Those are the doctors that are going to treat you. Then you have what are called general surgeons. Let's say you are involved in an accident and then your liver gets damaged, or our elderly who have cancers in the stomach, in the intestines. You have general surgeons who are, it's a broad topic, a broad field. You can have a surgeon who operates on the liver, called a hepatic surgeon, who operates on the colon and the small intestines, called a colorectal surgeon, and many other types of surgeons. And then we go down to the kidneys. The kidneys. So when we put food and water in our mouth, it comes to the stomach, then it's absorbed into the blood vessels. So some of the stuff that comes from the blood that the body is not using, it has to go through the kidneys. So the kidneys now have to, they sieve the toxins, come out what we still need in case the body is losing stuff that the body needs. The kidneys are going to reabsorb those, and then they're going to make the watery stuff. Can you guys hear me? Hello?
Yes, we can hear you.
Can you hear me?
Yes, we can hear you.
Yes. So,
Yes, we can hear you, Uncle.
Yes, we can hear you.
yes. So the water comes to the kidneys. Some of it is absorbed back into the system. The one that is made out, it's that the body doesn't want, is made into urine. It comes down through those two round things at top are the kidneys. Then there are two pipes there that are brown that come out. That's where the urine is made in the kidneys. It comes down through those pipes into the bladder. That's the brown thing called return urinary bladder. Then we urinate it out. Then we come to the reproductive. This is the male reproductive system. And then the next one, this is a female reproductive system. This is where the eggs are made, and the baby grows in the womb. And then this is the picture of a pregnant woman, and then the doctor who helps in delivering and giving and help women give birth is called an obstetrician and gynecologist. This is my favorite field. This is what I enjoy doing every day. Giving, here you are helping everyone give birth. Everyone have a smile when they have a baby and they take a baby home. And then there are doctors who deal with bones. So a human body is made up of bones and the connection of bones. For me and you to move from here to the fridge to collect, these are the bones that help carry us through. It's actually the cage. Everything is almost in the chest is encased in the chest, which is made up of ribs, which are bones. Sometimes these bones get broken in accidents when we fall. Unfortunately, some people get shot. So you need a doctor who fixes those bones. So the doctor takes you to theater. You see the picture on your right. This is someone who was involved in an accident and the bones got broken. So a doctor had to take them to theater and fix that bone again so that they can walk. Then we have a doctor who deals with blood. So that's blood that is spilling there. And the blood is made of many blood cells, but the predominant blood cell is the red blood cell. That's why the blood is red. So the function of the blood cells, we have many components in the blood cells. You have red blood cells, they carry oxygen and food to the tissues so that you can stand up. You need food. It comes via the red blood cells. You have white blood cells. When you have infections, these are the cells that fight infections on our behalf. And these red blood cells, they are in the blood vessels. As you can see on the right, this is the vessel that is encompassing the blood cells. Then that nice picture, that's the picture. Hello. That's the picture of the heart. The heart pumps blood to the vessels. It goes out out of the heart through the red vessels. It comes out. Then when the blood has been used and is dirty, it goes back to the heart through the blue vessels. Sometimes you get diseases in these vessels. You need a doctor who's going to operate and open those blood vessels. It's called a vascular surgeon. And then sometimes you have a doctor who doesn't really touch patients. You have a doctor who treats people only via a microscope. These are the technicians of the doctors. When someone has a cancer or someone has unfortunately died, we need to see what killed them. We take a piece of meat, we send to these guys, they look under the microscope, they tell us, no, this patient died of this, and this patient dies of this, Or you have a disease that we really can't see what it is, we just take a piece of something, we send it to them, then they will see under the microscope what it is.
Okay. Thank you.
Then we have doctors who deal with the skin. The skin is the biggest organ of the body. So if they ask you at school which organ is the biggest in the body, is the skin. Ne? It's an organ on its own. So you have doctors who treat the skin, and these are dermatologists. So skin conditions that are very common, we have acne. The lady up there has acne. You see those pimples there. So there are doctors who specialize in treating to make our faces cute and pimple free. Then we have the young boy down there has eczema. This is where your skin is itchy, and you have doctors who specialize and help us with our skin so that we are always okay. Then we have doctors who only work in emergency. Sometimes some of us are asthmatic, some of us have heart conditions, some of us have all these diseases that sometimes they attack us. You need doctors who are ready, almost waiting for such to happen. They come, they resuscitate, they make sure we breathe okay, they make sure our hearts are functioning okay. These are called emergency room physicians. They are specialists who work there. Then sometimes there are accidents that happen and trauma, people get bitten, people fight and others get injured. So that if someone was involved in an accident, sometimes they need to be operated so that it can save their lives. You have people who operate on such to make sure people don't die from such accidents. They're called our trauma surgeons. Then we have doctors who only work with scans and x-rays. They also don't like touching patients. These are the doctors who work with pictures. You get injured, you fall. For us to see that you have a fracture, you take a scan, and the doctors who are specialists in seeing these, if you fall on your head and you bleed on to the brain, before the neurosurgeon has to operate you, you have to go via this doctor so that they can see the scans of your head. Then we have doctors who treat most of you, the kids. These are called pediatricians. They treat all baby symptoms. Then there are doctors also who operate on kids. They are called pediatric surgeons. I hope most of you will be pediatricians. Babies are very cute things. Ne? Then we have the elderly and the loved of our society. They are doctors who are specialists in that. They're called geriatricians. You have to treat our elderly with respect. You have to be very patient with them. You have to pray for them. They have many diseases, and all they need from you as young people is love. And when you grow up, hopefully you become doctors, you choose to treat them because they gave life to us, isn't it? We all have grandmothers and elderly people in the society. So these people need us all the time. They need us always. Some can't do things on their own. Therefore, some doctors are specialists in treating elderly people in the elderly homes. Then you have diseases of muscles and joints, the arthritis. You always hear our grandparents complaining of backache. The knee is sore, the feet are sore. So most of them have arthritis. Some of the arthritis starts early. A picture of someone with rheumatoid arthritis there, because it's a disease of the joints, the ligaments get damaged, and then you have the shape of the fingers and toes become distorted. Then we have doctors who are specialists in drugs. They specialize in advising other doctors about which drug to work in which particular condition and which particular bug. So these are called pharmacologists. They work together with pharmacists. Pharmacists are not doctors, but they help doctors with dispensing the drugs to you so that you can feel better. Then there are doctors, before you get operated, you have to be operated while sleeping because it's painful when you are not sleeping. So these are anesthesiologists or anesthetists. They put you to sleep. When you're being operated, you don't feel anything. You are in deep sleep. When they wake you up, you realize, no, they cut me there and there. These are our anesthesiologists. They are very, very important people. They also help us in ICU. Some of sick people can't breathe on their own. The lungs are not working, the heart are not working okay. They are putting machines in. Everyone has it in those movies or whatever. You have those machines that go tee, tee, tee. These are the doctors that operate those machines. And those are the doctors that help you to stay awake even if you're about to die. Those are the big doctors who wake you up. Then we have doctors who work in public health to make policies. Public health specialists, they work with World Health Organization for them to say, this is how the nation is supposed to deal with this. We get guidance from such organizations. These are public health specialists. They are leaders in government and in high offices. So these are the people who make decisions for us, for other doctors. If this is a pandemic, like in the corona. So that's the picture of the coronavirus. Everybody knows about coronavirus. So there are doctors who are specialists in this. There are doctors who are specialists in this, doctors who know a lot about this. They are called microbiologists. You can either be a virologist to deal and treat COVID, HIV, flu, and other viruses. Then you have bacteriologists, doctors who treat TB, pneumonias, and they are specialists in knowing which bug most likely causes this, which bug is this, and if there is an outbreak, these are the doctors who first tell us, and they under the microscope they can tell us which bug, if it's a common bug or it's a new bug that people don't know about. Then obviously doctors can't work by themselves. They work with other healthcare workers, the paramedics. These are the pharmacists. They work with nurses. They work with psychologists, lab scientists, and physiotherapists. This briefly, before I take your questions, this was the presentation. That's a picture of doctors who are operating without touching a patient. These days, technology has given us that. I personally love doing that. We operate on inside the abdomen using small cameras. We see on the screen like we are playing PlayStation on the human tummy. It's very, very interesting and nice. Hopefully, most of you will join me and be laparoscopic surgeons and be neurosurgeons and heart surgeons. I think it's time for a question and answer session. I will answer most of your questions. If I don't know, I will let you know, or I will get answers for you.
All right, thank you much, Doctor. Thank you very much, Doctor. Can you please just pull down your presentation so that we can see everyone on screen, so that when they lift their hands, we'll be able to see them.
Okay.
No, say at the top, end presentation, or is it end screen sharing or stop screen sharing? At the top,
stop share, ne?
Yeah.
Okay.
All right, guys, did you enjoy that?
Yes.
You know what I learned? I learned that the ear doctor is called otorhinolaryngology. What is the ear doctor again? What is the ear doctor? Who knows? Otorhinolaryngology.
What's the ear doctor?
I've bitten my tongue.
Give it to try.
Tiwange.
Do you have a question? Do you have a question for the doctor?
Tiwange, you can.
Yes.
What is an ear doctor?
It tells you.
All right. Let's ask questions.
Hello.
If you have questions, hello. If you have questions for the doctor, please lift up your hand, or you can lift up your hand like this, or you can use the lift your hand button.
We've lifted the hand.
No.
I lifted my hand.
Lift your hand.
Who is that? Mapanzure.
Yes.
Okay, yes. You can shoot. What's your question, sir?
My question is, after you've studied to be a pediatrician, can you study to be to specialize on being the brain, or yeah?
Yes. So pediatrics is broad as well. So you can be a pediatric cardiologist. You can be a doctor who treats the heart of kids only. You can be a pediatric nephrologist. You can be a pediatric neurosurgeon. So you can be a doctor who treats the brain of babies only. So yes, it's but you first have to you specialize, then subspecialize. So that's what happens. Yes, yeah. You want
Okay,
to
can
be
I
one?
have Liema? Liema, your hand
Yeah.
is up.
No,
What's
I
your
put it
question?
down now.
Put it down. Leah, your hand was up also. All right, I will have Magabongwe and then Nobu Siso next. Magabongwe, shoot.
I think some doctors study the brain and some others study on the bones.
Yes,
What?
on the
Some
bones.
other doctors study on other parts of the body.
So what do you
Yes.
want to do? Magabongwe, what part of the body do you want to specialize on?
Our bones.
You want to be an
Why are they
orthopedic
so
surgeon?
hard?
Sorry?
Why are our bones so hard?
Why are the bones so hard? So the bones are made of. So the bones are made of a matrix which looks like concrete. So that matrix has lots of calcium. Calcium is the white part. So so God made us in a way that they are so hard. So the things that make it hard is the calcium and the phosphate. So when they mix, they're becoming calcium phosphate. It's actually a hard thing. So as we grow up, the calcium keeps accumulating in the body. Then when we are old now, our body cannot now keep putting calcium in the bone. So we lose the strength of the bone. Hence the elderly always have bones that are painful because they're no longer as strong because the calcium is now slow.
But I think I know one creature that can break through the bones.
What is that?
Tea devil, I think. It lives in Tasmania.
Oh, okay.
It lives in a Tasmanian island.
Oh, okay. Is it an island?
No. Yeah, it's an island.
Okay.
All right, thank you, Magabongwe.
And
Nobu
go to the
Siso.
boat. How do you if someone has a brain problem, how do you fix it?
It depends on the problem that is in the brain. If there is a mass or a cancer in the brain, you open the head, you cut through the bone of the head, you put it on the side, then you carefully and nicely dissect the brain and you take it out. It depends on this, not anything.
Don't people feel different when they hold someone's brain in their own two hands?
Don't people feel what?
Don't people feel something?
Like getting scared?
Hands.
No, you initially when you get to medical school, you are going to be, they will introduce you to you are going to see live all organs and parts of the human body. So by the time you get to be the doctor maybe in 5 or 6 years later, you're no longer scared to touch anything. So initially, yes, it's scary, but it's quite nice. After a few weeks, you are used to it. You can touch a finger, you can touch an eye on its own, you can touch the liver, you can touch the brain. Yeah.
All right. I will have the following people ask their questions quick. Kayla Mukuyu, and then I will have Leah, and then I will have Mercy. Those three first. Kayla?
I was asking if you are a trauma surgeon, do you have to do surgery?
Yes, for you to be a trauma surgery, for you to be a trauma surgeon, you first, after finishing your medicine, you have to specialize to be a general surgeon first. So then after that, then you train for another 2 years. So to be a general surgeon, you train for 4 years. After that, you train another 2 years to be a trauma surgeon. So a trauma surgeon, is someone who operates people who come in emergency situations, and you need to operate them. Maybe they are shot, they were in an accident, they are bleeding. So that's a trauma surgeon. You need to go back to learn again, so that's because when you're a general surgeon, you are just a surgeon in general. So now you need to scale it down to just trauma.
Okay.
All right, please next.
How do they open the womb and take out the baby?
How do they open the womb and take out the baby?
Yes.
So remember I said there are doctors who put you to sleep when you want to be operated. So the doctors, either they put you to sleep or they give you injections so that you don't feel pain at that particular point where you want to be operated. So they will make an opening in your tummy, and then they go to the womb, then they take out the baby. And then the baby cries.
So, all right. I'll have Hazel P and yeah, Hazel P, ask your question. And then I will come to Jordan. Hazel.
Can you be more than 3 doctors at once? Like, I want to be a virologist, a ENT surgeon, and a doctor who makes people give birth.
No, you can't be. You have to choose to be one, because you can study all of them if you want to. If you have time, you can study all of them. But remember, medical school studying time is very long. So you can't, if you want to be a virologist, if you want to be a gynecologist and obstetrician, it takes you 4 to 5 years. If you want to be an ENT surgeon, it's another 4 years. If you want to be a virologist, it's another 4 years. So, but at the end of the day, they will ask you, remember, you are now a specialist, you need to choose what you want to do so that you can give all the time to the patients who need you. You can't have patients, you can't be treating many things, because then you're not giving utmost care to all your patients. The reason you are a specialist in something is so that you can give proper and good care in that field that you know best on. So you
All
can't.
Right.
So you can't treat everyone for everything unless you are a general practitioner. A general practitioner is a doctor who just sees people who are sick. Then if the people are complicated, then he sends to specialists.
All right, so I'll have Jordan, and then after Jordan, Lesonte, and then after Lesonte, I'll have Kosana. That order.
Which
Jordan,
one is the most exciting one?
The most exciting, I'm a gynecologist. To me, obstetrics and gynecology is what is interesting to me. It's interesting to me because every time when a woman goes home, they have a baby, they are smiling, the baby is smiling, so it's fulfilling to me. Women come to me with problems and I help them. When their wombs are giving them problems, I take them out. When they want to have babies, I help them have babies. If they want this and that, if girls are complaining of pains, I treat them. To me, it's interesting. But also what is interesting, I think all branches of medicine are interesting. The second most interesting to me is the radiology, because you deal with the physics. You don't see the patient, but you see the patient either way. You have pictures that you are at home, you can treat someone in Cape Town when you're in Joburg via technology. So radiology is also interesting to me. The other thing that is interesting to me is operating on the heart and being a cardiology, because everything stops at you. If the heart stops, someone is dead. When you are as a gynecologist, my patient can afford not to have a womb and still be alive. As a neurosurgeon, someone can be brain dead for 5 years. As long as the heart is pumping, they are alive. So everything stops with the cardiologist and the heart surgeon. So I think it's very, very interesting knowing that you are the ultimate person. If you fail to do something, someone is dead. So I think it's interesting to me. Those are the three most interesting to me. But everything is interesting. Some people love bones, some people love urology, the urologists, the people who deal with the males, they're helping the elderly who can't help themselves. Some people are intrigued by pediatrics, working with young babies. The neonatologists are the pediatricians who work with very one-day-year-olds, working with tiny human beings. It's interesting to them. So it's very wild. Medicine is very wide and broad. Some people just want to be doctors who are in business. They just become general practitioners. They open branches and they just want money out of it. It's what you want.
Okay, so Lesonte.
Doctor, if your skin is bad, if the doctor can't take your skin off, they give you a Vaseline.
Yeah, unfortunately, no one can. Unfortunately, you can't remove the skin unless the skin is now dangerous to you. So what they do is the dermatologist will give you many ointments which look like Vaseline, but no one can say you have eczema, you have acne. Let me take that piece of skin away, because if you take it away, the other skin will grow and that eczema or acne will come back there again. So we don't take out the skin. We do have doctors called plastic surgeons. These are general surgeons, or plastic surgeons are doctors who make, if you get damaged in the face, they reconstruct to make sure you are as you were. So it's also quite interesting. Ladies love it. Most ladies, when they have money, when they are becoming old, they go to them so that they can look young and new again. If your
Right,
face, if your
Nkosana.
face,
Okay, you can continue, doctor. Then after that, Nkosana will ask you a question.
if you get bent in your face, in your arms, in your abdomen, and now you have wrinkles that don't, so you go to these plastic surgeons, they can remove that and then they can put new skin in there. Yeah.
All right, Nkosana.
Doctor, I wanted to ask, if let's say I want to become a neurosurgeon, do neurosurgeons only deal with the brain, or do they also work with the nervous system and the spinal cord, etc.?
So a neurosurgeon is a doctor who operates, actually neuro means nerves, ne? So these are the doctors, if you need to be operated, remember the nervous system starts from the brain into the spinal cord, into the nerves down, branching out. So you can have a so lately in medicine, you sub-branching everything. So you do have neurosurgeons who are spinal surgeons. And also remember, the spinal cord is bones that, spinal cord is encased in what is called the spine. The spine is a bones that starts from the head down into the pelvis. So they are spinal cord is a group of nerves that travel there. So the doctors who are going to operate there are called spinal surgeons. So you can be either those doctors who operate in bones, they can also operate in the spine there. And also, your question, neurosurgeons, a neurosurgeon is going to operate anything which involves the nerves. But then they are not going to treat if you can't lift your hand because your nerves are not working, you go to neurologists instead. But
all right, so Azi and Edson and Muta. Azi first, then Edson, and then Muta. Ask your questions. Azi?
Why do we have doctors if God is here to heal us?
So we do have, like I said when I started, doctors are God's right-hand man. God is everywhere, but God does not come in person to operate you. When the baby cannot come out in the mother's womb, God will not perform a miracle. He can, but he has instructed and empowered the people so that they can know how to treat us, so that the people can know the know-how of how to treat diseases. Ultimately, there is no doctor who can play God. No one can create a person from nowhere like God does. But God has taught us and given us the knowledge to know how and when to treat. At the end of the day, it's still his decision. No matter how good we are, no matter how good a surgeon is, when God has decided, no, you cannot be treated, you need to die, you will die. If people want to kill you, but God says you are going to live, it's God who makes those decisions. So at the end of the day, it is God who heals. But God uses us as doctors to treat people.
All right, who's the next person? Is it Kyla and Edson? Yeah? Kyla?
I wanted to ask, how do plastic surgeons putting on new skin if they can't take off your skin? And
There are situations. Sometimes you get injured already and you don't have skin somewhere and you need to have skin. So what they do is they can harvest skin from another part of your body and put it there. Or sometimes they are what are called skin banks, so they can get some skin there. But mostly you don't take out healthy skin unless you are putting it somewhere. So what they do is, let's say you are bent or you have a big wound that is not closing up. So they are the ones who are going to come, reconstruct that, try to close that wound, and then put some new skin there. So they can harvest. It's called harvesting. They can go to your thigh, take a bit of skin there, and then they put it somewhere.
But where do they get the skin to do plastic surgery?
They take it in your body. So they can take skin from your thigh, they can take skin from your back, and then they can put it in where the wound is.
So what you're saying is we've got extra skin somewhere, somehow.
We don't have extra skin, but our bodies can reproduce skin. Like remember when you get hurt, it becomes open, but the body has a way of closing there as well. So what we use then is that idea and technology that your body can reproduce. There are organs. Most organs can heal and reproduce the cells as well, but most of them. But some, like the nerves, don't reproduce. Once they are dead, they are dead.
All
but
right.
the skin can
Edson, and then Sharon, and then Mapanzure, and then Muta. Edson.
But I'm asking about.
Sorry?
Edson, come.
The heart be beating because you can breathe from the heart, which is beating.
What's the question? Sorry, come again.
The heart been beating because you can breathe if the heart is beating.
So the heart and the lungs work hand in hand. So the heart, when the heart is beating, it's sending blood via the lungs outside. Remember, when you breathe in oxygen. Oxygen is the energy that we need. So that oxygen gets in the lungs, into the lungs. Then you have the blood in the blood vessels from the heart. It passes through the lungs, collecting oxygen to go as a messenger, to go and maybe give the toes the energy, or maybe to give the arm the energy, to give the eye the energy. So when most of the times when the lungs are not working okay, it puts a strain or a stress on the heart, and then the heart also starts becoming sick and ill. But you can, so now if you're starting to breathe, remember I said there are doctors who help us when we are, those sleep doctors can help us breathe well if we can't breathe. They can help put machines that will breathe for us as long as the heart is working. So yes, the heart can work when you are not able to breathe. But on your own, when you are home, we don't have that machine. When you fail to breathe, the heart will automatically stop as well.
All right, Muta.
Can your brain grow?
Yes, the brain grows, but then the brain stops growing at a certain age. So when we are born in our mother's wombs, the brain starts as a small thing. Then it keeps growing, It's growing, and the nerves are being made so that when we are born already, we can have movements. These are the nerves that are working. So when you are born, we assess if the brain is okay by you crying. When a baby is crying, we know, okay, the brain is working okay and the heart is working okay. Then we stimulate them to see if they can move their limbs. That's also a test to see if the brain is working. But then the brain stops working at a certain age. So when we are in our mother's wombs, the biggest organ is the brain and the head. Then when we are born, the brain grows a small bit, then stops growing, the skull closes. When after the skull closes, the other parts of the brain, of the body starts growing as well. And we get to a situation after a certain age that the head is small, but the body is now big. So at a certain age, the brain stops growing and everything is okay in the brain. So what starts growing in other parts of the body? Are you answered?
Yes.
Good, Ken. Next question. Let me see the questions in the chat.
Doctor.
Yeah, well.
Can I ask, do dentists also study medicine?
That's a very, very good question. A very, very good question. Dentists are doctors, like medical practitioners. They do go to medical school. All medical school have is called School of Dentistry. That's the study the study to become a dentist is called dentistry. So the length of studies is the same. The only difference is dentists don't study other organs. They are the only doctors who don't study anything about the heart, anything about the abdomen, anything about other bones other than teeth. They only deal with teeth. So
Okay.
yes, they are doctors. They go to a medical school, but they don't study medicine.
Is Mama coming?
No.
Why? Go and call her. Put the Bible down.
Why is coming right now?
Go and tell her to come.
Hello, doctor.
Hi, how are you?
I'm fine. My name is Eden.
How are you, Eden?
I'm fine. I want to ask that what do you use to cut the stomach when then cut the baby?
So when we are taking out the baby, we use a knife. There's called a surgeon's knife. It's not the bread knife that is on the kitchen, in mommy's kitchen. There is a knife, a surgeon's knife. It looks like a razor blade. It's very, very sharp. So we cut nicely. We make sure she doesn't bleed. We make sure the baby comes out okay. Then we close again using a stitch or a suture, something which looks like a thread that mommy uses to sew if mommy does some bit of tailoring. There's something that we use to suture the body of a person.
And how big is it?
The surgeon's knife, it's not very big. It's smaller than the bread knife, but it's sharper than a bread knife.
Okay.
Mm.
Thank you.
All right.
How old do you have to be if you want to be a doctor?
Any age. You can be a doctor at any age.
Oh.
At 3.
Mm. But you have to finish school first.
Even now.
No, you have to finish school. You have to finish school. You can't be a doctor now. You have to pass.
Why?
So I see a question here from Leah Kisono. Says, how do babies breathe in the mother's womb? So
I know.
So the babies breathe. So a baby in the mother's womb is in a sac which is full of water called amniotic fluid. So that fluid there has everything that the baby needs. It has all the food. The baby's urine in the mother's womb is very, very clean like tap water. So they drink that urine, which they also pee, and it gives them fluids. That's how God created it. Then the baby there are respiratory movements. We start from around 4 months when the mother is pregnant. The baby starts breathing movements, and the lungs are being made. When they swallow that fluid, it goes to the lungs, makes the lungs grow. The heart starts beating from around 1 month. The mother is pregnant. The lungs will start moving from around 4 months when the mother is pregnant. So all those, it's an interplay. The baby's heart does not beat like the heart of an elderly person, because they beat into the placenta, which feeds the mother, which is from the mother feeding into the baby, and then the circulation is not really the same. But the babies do breathe inside the mother. They don't breathe oxygen in and out, but the lungs move in and out. So when they move in and out, it's the fluid that goes in. That fluid contains substances that make the lungs grow eventually. So when they are born, with their first cry they release all the fluid that is in the lung, and then the air spaces expand, then they take in their first breath, and then they cry. That's why it's important for them to cry. So when a baby is born and they don't cry, we are all worried. So we know there's something wrong. Is it in the brain? Or is it in the lungs, or something is happening?
With Sharon with their hand up. Sharon, you can ask your question. And then I see another question on the chat which says, why are injections important? Why are injections important? Sharon, ask your question and then the doctor will answer that. Sharon, you are muted. You are muted. Unmute yourself.
Hi, Sharon.
Hello. I'm asking, why when we're having a baby we get inject? Why do they inject the baby when?
So when a baby is born, So when a baby is born, the baby is born with a weak immune system. An immune system is the system that we all have that protects us from infections. So when we are given injections, they have what is called, the vaccines contain some soldiers that help the babies fight infections. And sometimes the other injection that they give is to help the baby not bleed easily, the vitamin K and the vaccines and all that. So generally everything that is given to the baby at birth is to help the baby cope with infections, fight infections better, so that the baby doesn't just bleed, because they are very, very fragile when they are born. So as we grow older, our immune system gets bigger, our immune system gets wider, the variety, and they can fight infections. So that's why they will tell you you need to be injected. This is to help your body fight certain bugs that otherwise we can't fight on our own. Then the question about why are injections important? The injections are important because remember, when you take medicine into your mouth, it has to go through the mouth, through the tongue, goes through the gut, into the stomach, into the intestines, then it is absorbed into the system, then it starts fighting. Sometimes that process takes more than 8 hours. So sometimes you need a drug that works there and there. It's in an emergency situation. If you inject it, within a few minutes it's already in the system and it's acting. So they are very, very important. Or sometimes some medication, when you take them through the mouth, they get destroyed by the acid in the tummy. So you cannot really take them. Or sometimes when you take them through the mouth, they have these toxic substances that when they get into the body, they can damage us. So sometimes those are the 3 reasons why we get injections instead of taking them by mouth.
All right, then there's Huawei P10 Plus. I don't know your name. And then Tadi, please ask your questions.
Hello, doctor.
Hi.
Does a dietitian a doctor?
No, a dietitian is not a doctor, but a dietitian is one of the healthcare workers who work with doctors. So a dietitian, this is somebody who's going to help you with diet, who's going to tell you how to, depending on what condition you have, depending on what situation you are in. If you want to lose weight, a dietitian is the one who's going to tell you this is what you eat at what time. If someone is recovering from a long illness, the dietitian is the one who's going to tell you, no, eat this so that your body responds better, so that you get better earlier than you would. So a dietitian is not a doctor, but a dietitian is a very, very, like all other healthcare workers are as important as doctors, because doctors can't do everything on their own. Sometimes you need to concentrate on this while other people. So in medicine, we work as a team. So a team can have a doctor, a nurse, a dietitian, a physiotherapist, and some other people, sometimes even counselors can come in there to help the patient heal.
Okay, then we have Tadi, and then Luba. Luba, is your hand up? Luba?
Yes. Yes.
Okay, come and ask your question then, and then Tadi also, you'll ask your question.
Tadi?
Sorry?
Our doctors can treat animals.
Can what?
Can treat animals.
There are doctors who treat animals. They are called veterinary doctors. So a vet is an animal doctor. A human doctor cannot treat animals. an animal doctor cannot treat humans. So they go to a different school called the veterinary school. They are also very important in society for animals and other, but I'm not a vet. I know nothing about animals. There are doctors who do a good job in treating animals. We don't do the normal schooling. We don't do the same school. They don't go to the normal medical school. They go to a veterinary school. It's also 5 years, 5 to 6 years as well.
Okay, Tadi.
Yeah, I just wanted to ask, what is the use of a bone marrow?
Tadi,
So
why is your picture hidden? Okay, doctor. Doctor, what is the use of a bone marrow?
So the bone marrow is a fatty substance that is found inside the bones. So the bone marrow is where the cells that make blood cells, that make other make white cells, they come from the bone marrow. And also the bone marrow, especially the one in the ribs, is the one that makes the red blood cells. That blood that you see, that when you cut yourself bleed, it comes from the bone marrow. So the bone marrow manufactures is the source of all those cells.
Okay, thank
All right,
you.
doctor, there are questions that are in the chat. After that, I'm coming to Galaxy S8 Plus. The first question is, how long does it take for you to become a professional doctor, right? And then the second one is, how do you close the tummy? I think when you do operations for babies to come out. And
Okay,
then the
so
third one,
You
is it
saw
true?
it.
Is it true that
you-
when you grow, your bones also grow? And then the last one is, how do you get the medicine into your body?
all right, so
If the mother takes drugs, does the baby get affected? So I think you can see the questions on chat there.
yes.
Please respond to them. And then after that, I'm going to give the last 3 hands, and
Okay.
then we call it a day.
Yeah, these are very intelligent questions, I can see. How long does it take for you to become a professional doctor? So let me take it from you have finished school, high school, you have finished matric or whatever school you go to. So first you go to 5 to 6 years of medical school, depending on which country or which university you go to. Let's say maximum 6 years. Remember, you are at school, you can repeat, if let's say no one is repeating, 6 years maximum to be a doctor. You are a junior doctor for 2 years. Okay, in the South African perspective, 6 years of medical school, then you do 2 years as an intern, you are a junior doctor. Then you do 1 year mandatory ComServe. This is where you are serving the community before you make your own decision. This is where the state says, help everyone, give back to the community for what they've done to you and for you. That's now 3 years, that's 6 plus 3, that's 9. Then after that, you choose to specialize. If you want to be a surgeon, you add 4 more years. So that's 6 plus 4 plus 5 plus 3. So that's around 13 years. But suffice to say, after 6 years, you start earning money, and you start earning good money. It's not a lot, but it's very good. You can manage to buy a car, a house. You can manage to do anything with the salary soon after you graduate. Most of us graduate at the age of around 23, 24 years. And you already, so by the time you are around 33, most people are specialists. But then some people then decide to first become, after your internship, you can decide to be a general practitioner and you make money from there. And if you're content, you're content. It depends. But if you want to be a professional specialist, maximum after finishing matric, just calculate maybe 13 more years. Yep.
So how do you close the tummy?
You close the tummy. I think I alluded to this question. You close the tummy where you cut, you go back to return to how it was. So there are instruments that we put to close to make sure we don't lose the organs, and then we suture. It's called suturing. It's a needle. The same way you are going to suture a torn T-shirt or a torn jean. That's the same way we suture. We suture. We make sure after you've sutured, you make sure there is no bleeder. Then after closing the womb, we come to a layer above the womb. Then we come to a layer under closing the abdomen. Then we close the skin in layers. We close it in layers. How we found it, how we cut. And if you cut systematically. You just not cut. You cut systematically and carefully, so that you can see afterwards when you're trying to close where you were cutting.
Okay, so the other question is it true that when your bones grow, when you grow, your bones also grow? That's true,
Yes,
right?
very true. Your bones grow, but they grow to a certain age. After a certain age, they don't grow. After a certain age, that's why you can only grow so tall. There are what is called growth plates in the knees, in the ankles, in the hips. There are growth plates there. So when we keep, as long as they are not closed, it means your bone can grow in length. That's how we attain our height. So after a certain age, usually from up to around 20 to 25 years old, they close. So now the bones, they can get stronger up to around after 26 years of age. No bone grows. You can only be losing. Then for women, by the age of around 51, the bones start becoming thin, and then we go back to being kids as well with brittle bones. So yes, they grow. The question is they grow, but to a certain age. So my bones are no longer growing. Shepherd's bones are no longer growing. Your mom and dad's bones are no longer growing. But your bones will keep growing till you attain a certain height, and your epiphysis is called growth plates. When they close, usually at a certain age, you are no longer growing.
And then if a mother takes drugs, does that affect the baby?
Yes, this is a very, very intelligent question. Yes. When you take medicine, ultimately, whatever you take, most of the things we take, they get to the baby if the mother is pregnant. Some are good, some are bad. Some they affect the baby, some they don't affect the baby. So what we do as obstetricians and gynecologists, we study these medicines to know that if you take this medicine, maybe we trial it maybe in mice and rats and monkeys to see if we give the monkey this tablet, does it get to the baby and does it affect the baby? So then if we see it does affect the baby, then we stop it. We give alternative drug. So we know when a mother is having pain, we know we can give a paracetamol. It was studied and seen that the paracetamol doesn't affect the baby. It does get to the baby, it doesn't affect the baby. Then there are some few medicines that we know that are not going to get to the baby. These are big medicines. They are made in a way that their chemical structure is so big they cannot pass through the placenta into the baby. There are few of those though. But yes, the baby, the medicine gets into the baby. Then I can see how does medicine get into your body? So the medicine, obviously, it has to it diffuses through the blood vessels, and then it gets into the system of the vessel. Yes. Hello?
All right, then we have Tadi and Galaxy S8. Tadi and Galax, I think these are our last questions, right? Tadi?
Morning, doctor.
Morning, how are you? Afternoon.
Tadi is not there. Galaxy S8.
May you please explain to us about growing pains?
Growing pains.
Yes.
Growing pains, these are pains when everything is stretching. So if any organ in the body is stretching, there is a stretch to the nerves. So those nerves become painful too. So that's what growing pains are, because we are growing taller. Our body. So our body is becoming longer. So there is a stretch to the organs. So there is pain. And if anything is stretched, there is pain.
How do doctors heal people so easy?
Sorry?
How do doctors heal people so easy?
So we heal so easy because we do it again and again. Practice makes perfect, and we study again and again. We keep studying. In medicine, you have to keep updating yourself to know the new drugs that work better to treat patients. So every day there is something new that you can learn. You learn till you die when you're a doctor. And as you do things again and again, it becomes easy. The way you operate becomes easy. The way when a patient comes to you, before they can sit down, you already have a diagnosis. Sometimes when they speak to you for 1 minute, you know, okay, this is the disease, and then this is how we treat it. When they have side effects or complications, we know how to treat them because you have seen it and you have done it again and again.
Who else had end up? Sharon?
I want to ask, why does the air that you breathe go into the lungs instead of just going around the body at first?
Oh, okay. So our body has valves, especially here. When you are breathing, the air is directed down the windpipe into the lungs. When you are eating, there is also a direction in the gut that closes the air passages and opens the gut so that the air goes into the stomach. Same as you are breathing. So if you try to eat and breathe at the same time, that's why you choke, because both valves will open and food will go into the wrong pipe. So the valves open because you're knowing good, no, this is air that is coming, let me close this valve. Now this is food that is coming, let me close that valve. That's how the body works. Ne?
Thank you.
Who else has end up? Galaxy S8, I think that's the last question. Eh? Galaxy S8.
I've already asked.
Oh, so are we done for today? Are we happy?
Yes.
All right.
Who wants to be a doctor? What type of a doctor do you want to be?
Me.
What do you want to be?
This is my favorite. All about animals. Yes.
My favorite.
Talk to them nice.
I want to be like a doctor.
You want to be a
I want to
doctor?
be a dentist.
You want to be a dentist?
I
Nice.
mean a vet. Can I ask a question?
One more question, doctor.
I want to be a vet.
He wanted to dominate her. He wanted to have power.
I want to
You
be
know how
a farmer.
You want to be a farmer?
I want to be a doctor.
probably
Oh, guess what? I want to be a doctor.
That's cool.
way that it explains.